Welcome back. Is still seeking solutions on NTA Enugu Network Center. We're here discussing measles, the signs, symptoms, prevention, treatment with Dr. Ndoka in the house. Okay, doctor, maybe we should look at some of the preventive vaccines available for measles.
The measles vaccine, it's administered when the child is 9 months, and it's administered once, and it's a live attenuated vaccine, meaning that it's actually a live measles virus which has been attenuated, it's been made powerless, so that when it is administered to the child can actually be able to surmount the overpowered measles virus and then mount an immunity, so that whenever the person now comes in contact with a measles virus from any other person that comes out with that has measles, the person may be able to mount a good immune response and overcome the measles. However, it does not totally prevent one from coming down with measles. However, it gives you the ability to prevent you from coming down with severe forms of measles. That's what the measles vaccine does.
Okay, so in other words, you're saying that being vaccinated with the measles vaccine does not even secure you, stop you from coming down with measles.
Exactly, it doesn't stop you from having measles. However, it gives you an edge, in which case you can mount a good immune response when you become exposed to the measles virus and not come down with the severe forms of the illness.
The vaccines, are they taken just once in a lifetime?
Yes, it's given at when the child is 9 months. However, different countries have different vaccine schedules. However, that for Nigeria, according to the National Program on Immunization, administers measles vaccine only at the ninth month of life.
Okay, I do, see some pregnant women that come down with measles. How come, and what's the danger given their condition?
Measles in pregnancy is a very, very dangerous situation, and it comes with a lot of complications, both to the mother and the child. It can lead to both the death of the mother or the child, and it can also lead to spontaneous abortions or congenital malformations. So any mother that is diagnosed with measles is actually a very serious situation and needs to be managed very closely by her physician.
Wow, that's serious. Okay, now how can these measles be managed?
Measles, as with other viral infections, are managed conservatively, based on the symptoms that the patient presents with. As I've mentioned, the patient comes with fever, high fever, in which case we give antipyretics like paracetamol, or we also educate the mother or the caregiver to expose the child whenever the child has fever at tepid sponge, with what we call tepid water that is lukewarm, the same water that you can use to bathe the child that is not hot or not cold. So you can use that to tepid sponge the child so you can control the fever. Then also, when the child, they can come with cough, they can come with the conjunctivitis, they can come with the nasal discharge. We can give antitussives which can help with the cough, and then also because of the pathophysiology or pathogenesis, how measles comes on, it exposes the person to other bacterial infections. So during the course of the illness, there may be need to put the person on antibiotics. Then there are also other drugs that the patient may benefit from. Most importantly is the vitamin A, which also, because of the way measles occurs, it tends to destroy the epithelium of the respiratory pathway. So vitamin A is very essential because it helps in the regrowth of all those epithelium and also in the regrowth of the antibodies that are responsible for fighting off the measles virus itself.
Is it necessary to quarantine patients of measles?
Well, yes, it's necessary to make them not to come in contact with the general population, or especially because of the age range that are most likely that are at risk of contracting the virus itself. School children or preschool children or even toddlers, whenever they come down with the virus, the disease itself, it's best to keep them, avoid them making contact with other children, because adults have the immunity already, or may have already had the measles infection itself, and will not come down with the illness again. So they can actually come in contact with the child. However, it's advisable to prevent the child with measles itself to not come in contact with others, and then also make sure the room is well ventilated, because like I said, it's spread through through aerosols. When the child sneezes or coughs, there will be an avenue for the virus to be dispersed into in the air outside the room where the child inhabits.
Are there some more complications that could arise as a result of measles?
Yes, there are more serious complications that can arise from measles. One of the commonest is otitis media. That is an infection of the middle ear. Like I mentioned before, the pathogenesis of measles, it tends to affect the epithelium, that is the surface, the skin of the linings of the respiratory tract, and then the other epithelia. So it can cause otitis media, which is an infection of the middle ear. It can also cause the child to have a pneumonia, which is an infection of the lungs. Then it can also cause other complications like croup, which is laryngotracheal bronchitis. It can also cause the child to have tracheitis. It can also cause the child to have diarrheal illness. These are all possible complications. There are other more severe complications of measles. That is why it's always advised that whenever you have the suspicion of measles, you always do well to present to your doctor, so that appropriate measures to be instituted to prevent the child coming down with these complications.
Are there some home remedies for treatment of measles? Because I do see some people, when they have the rashes, you see that they always rub this whitish whatever,
Okay. Yes. The child that has measles, like I said, will have fever. You can tepid sponge, wipe the body down with tepid water to prevent the fever from going up, because very high fever can cause the child to have a convulsion, condition we call a febrile convulsion. So keeping the body cool is one of the home remedies one can do. Then also making sure the child is well hydrated is also one of the measures that can also prevent the child, reduce the severity of the illness, making sure the child takes a lot of water. Then the whitish material, which you quite rightly noted, what we call calamine lotion, is what it does basically is to keep the body cool, because the measles rash itself can be itchy and uncomfortable to the child. When you apply the calamine lotion, it keeps the body cool and reduces the itchy sensation that the child can come down with. All the other management involved are based on what the doctor sees and then tells you to institute, both either at home or in the hospital on admission.
Okay, let's now generally look at the treatment of measles.
When you have a child, when your child begins to manifest symptoms of fever, catarrh, cough, redness of the eyes, it's best to present to your medical practitioner. At this stage, the doctor himself will have other disease conditions, and even measles, as a provisional diagnosis. He will administer antipyretics, that is, drugs that will control the fever. He will also give you antitussives, cough syrups to relieve the cough. And then when the child now begins to manifest the rashes proper, the doctor can either use the calamine lotion, which I told you basically keeps the body cool, or it can also give you other drugs that will also help with the itchy sensation that the person can come down with. Then the vitamin A, which I told you is very important in patients that have measles, is for those that are less than 6 months, is giving 50,000 international units on the first day and the second day. And for those that are above 6 months, you give 100,000 international units, still first day and second day. And those that are above 1 year, give 200,000 international units. Then other symptoms, other management procedures depends on the complications the patient can come down with. Those that come down with otitis media will need to be on antibiotics. Those that come down with a bronchopneumonia may need to be admitted, oxygen therapy, fluid therapy, either child taking in a lot through the mouth or as an intravenous or parenteral route. Then also those that have those that have diarrhea, that is frequent stooling as a complication, we also need other fluid therapy, and then also other treatment measures like the zinc gluconate that we give and other measures.
Okay, Doc. Before I let you go, I need your general advice to parents as per at what point they will need to bring their children to the hospital once they notice anything that looks like measles.
Generally, it's advised that when you have a child on the ward, or even you yourself, you have symptoms, you are not feeling fine on the first day. So, for example, you have fever on the first day, you give yourself an antipyretic or drugs that will control the fever, and then the second day the symptoms still persist. It's advisable to present to the nearest hospital for proper evaluation. Self-medication is never advisable. If you present early, the complications of measles are more likely they more likely will not occur. So early presentation is very important to avoid these complications from occurring, because when these complications come up, they will now cause complicate the management, and either result in you being on admission or result in longer duration of illness.
Okay. Dr. Nduka, I want to thank you so much for your time on Seeking Solutions today. I appreciate all that you have said here today.
Thank you very much.
Thank you. As you have heard, measles is not a death sentence. It can be prevented, treated, and managed. Valuable piece of information that will surely help us all out as we battle measles. And that's a wrap on Seeking Solutions today. Thank you for your time. See you around next week. Happy weekend.
Momo better pass car.